The United States Department of Health and Human Services, also known as the HHS, is a cabinet-level executive branch department of the U.S. federal government created to protect the health of all Americans and providing essential human services. Its motto is improving the health, safety, and well-being of America. Before the separate Federal Department of Education was created in 1979, it was called the Department of Health, Education, and Welfare. HHS is administered by the Secretary of Health and Human Services, who is appointed by the President with the advice and consent of the United States Senate. The position is currently held by Xavier Becerra, who was confirmed as Secretary on March 18, following his nomination by President Joe Biden. The United States Public Health Service is the main division of the HHS and is led by the Assistant Secretary for Health. The United States Public Health Service Commissioned Corps, the uniformed service of the PHS, is led by the Surgeon General, who is responsible for addressing matters concerning public health as authorized by the Secretary or by the Assistant Secretary of Health in addition to his or her primary mission of administering the commissioned corps. The Federal Security Agency Public Health Service Civilian Conservation Corps, and Social Security Board. By 1953, the Federal Security Agency programs in health, education, and social security had grown to such importance that its annual budget exceeded the combined budgets of the Departments of Commerce, Justice, Labor, and Interior, and affected the lives of millions of people. Consequently, in accordance with the Reorganization Act of 1949, President Eisenhower submitted to the Congress on March 12, 1953, Reorganization Plan No. 1 of 1953, which called for the dissolution of the Federal Security Agency and elevation of the agency to cabinet status as the Department of Health, Education, and Welfare. The plan was approved on April 1, 1953, and became effective on April 11, 1953. Unlike statutes authorizing the creation of other executive departments, the contents of Reorganization Plan No. 1 of 1953 were never properly codified within the United States Code. Although Congress did codify a later statute ratifying the plan, today, the plan is included as an appendix to Title V of the United States Code. The result is that HHS is the only executive department whose statutory foundation today rests on a confusing combination of several codified and uncodified statutes. The Department of Health, Education, and Welfare was created on April 11, 1953, when Reorganization Plan No. 1 of 1953 became effective. HUE thus became the first new cabinet-level department since the Department of Labor was created in 1913. The reorganization plan abolished the FSA and transferred all of its functions to the Secretary of HUE and all components of the agency to the department. The first Secretary of HUE was Oveta Culp Hobby, a native of Texas, who had served as commander of the Women's Army Corps in World War II and was editor and publisher of the Houston Post. Sworn in on April 11, 1953, as Secretary, she had been FSA Administrator since January 21, 1953. The six major program operating components of the new department were the Public Health Service, the Office of Education, the Food and Drug Administration, the Social Security Administration, the Office of Vocational Rehabilitation, and St. Elizabeth's Hospital. The department was also responsible for three federally aided corporations: Howard University, the American Printing House for the Blind, and the Columbia Institution for the Deaf. The Department of Health, Education, and Welfare was renamed the Department of Health and Human Services in 1979, when its education functions were transferred to the newly created United States Department of Education under the Department of Education Organization Act. HHS was left in charge of the Social Security Administration, agencies constituting the Public Health Service, and Family Support Administration. In 1995, the Social Security Administration was removed from the Department of Health and Human Services and established as an independent agency of the executive branch of the United States government. The 2010 United States federal budget established a reserve fund of more than $630 billion over 10 years to finance fundamental reform of the healthcare system. The Department of Health and Human Services is led by the United States Secretary of Health and Human Services, a member of the United States Cabinet appointed by the President of the United States with the consent of the United States Senate. The Secretary is assisted in managing the department by the Deputy Secretary of Health and Human Services, who is also appointed by the President. The Secretary and Deputy Secretary are further assisted by 7 Assistant Secretaries, who serve as top departmental administrators. As of January 20, 2018, this is the top level of the O.